Hi, welcome to Better Health Together, and you'll see I have with me Reid, CEO of the Cancer Council, and we're here to have a conversation about the 13 Cancers LiveLighter campaign, of which I was privileged to be here for the launch of that, and I was just taken aback by the correlation of being overweight or indeed obese and the relationship to cancer. So this is a really important campaign from our perspective, and one where primary healthcare also has a role. The WA Primary Health Alliance is also a partner with you in this project, of which we're really pleased to be. And I'd be interested, as we have this conversation, to hear from you about what you see as the role of primary care, how it can help, and what we might do going forward. But before that, can you talk to us about the campaign from your perspective?
Sure, thank you. So the 13 Cancers LiveLighter campaign is predominantly about raising the awareness about the link between being an over healthy body weight, so obese, either obese or overweight, and cancer. We know that the understanding or the awareness of the link between being above a healthy body weight and cancer is very low in the community. So it's down about 40% of people that know the link. That means 60% do not. And we're focusing on sugary drinks in this campaign because it's a fairly easy or simple behavioural change we can talk about. The link between sugary drinks and contributing to the build-up of toxic fat around people's organs, which leads to 13 types of cancers. The evidence is really strong. We've also seen in the evidence that if we could maintain a healthy body weight, we'd save or prevent around 200,000 cancer diagnoses over 25 years. So it's huge. We also know that 2/3 of West Australian adults and 1/4 of children are overweight or obese. So it's a huge problem. The link to sugary drinks, Australians consume 1.4 billion litres of sugary drinks a year, and nearly half of children are consuming them daily.
So what do you think the role of the primary healthcare system can be, and what can WAFA do to help you with this campaign?
Look, we're really proud to be partnering with you. We know that GPs have huge influence on people's behaviours, people's understanding around their risk, particularly around their cancer risks. GPs are trusted, and we want to make sure that GPs feel well equipped to have those kind of conversations with people who may be at risk. So by partnering with WA Primary Health Alliance, what we're hoping is that GPs will be better trained and better equipped to have those kind of difficult conversations. Talking about weight is really difficult, but we know the influence that GPs and primary healthcare can have. That's why we're really excited to be partnering with you and your organisation so that we can work at this from a whole range of different angles.
And both the WA Primary Health Alliance, Cancer Council, Health Consumers Council, State Health, we are all working collaboratively. I guess our slice, as you say, will be in that primary care piece, and working with both general practice and allied health to assist them really feel like they can take some leadership in their own practices. I guess the summary is, why are campaigns like this important? What is it that you think you can achieve through this type of campaign?
Look, we've had Cancer Council WA has had a long history of really effective and powerful public health campaigns. People may remember campaigns or know of campaigns like Make Smoking History, the SunSmart campaign. These campaigns have been longitudinally successful in changing behaviour. We haven't yet had, until these recent campaigns around LiveLighter, we haven't had campaigns around obesity, nutrition, physical activity that talk specifically about cancer and health risks like that. So we're hoping that with our experience of having those, really open and evidence-based conversations with the public about how to reduce their risk. We've got some great expertise in this organisation. By partnering with other great organisations, we're hoping to really change behaviours. We're also partnering with Telethon Kids Institute and Healthway. We're looking at it's a bit of a mouthful, but a rapid obesity policy translation exercise, which will look at the latest evidence and how we can quickly translate that into good practice. So by coming at this from a whole range of different avenues, we think that's got its best chance of success.
That's great. Thank you so much, Ashley. This is a really important topic for all of us, and we'd hope in watching this Better Health Together video, you might go away and see what you can do in your organisation. So thank you very much.
Great to talk
Bye
to you.
for now. See you
Thank you.
next time.